Attention, it is Monday. You guys know every Monday you can, you will, you must pass NCLEX. I am so happy to be with you. My name is Regina Callion MSN RN, CEO of ReMar Review, the #1 NCLEX instructor on your planet. That's my goal. And so every Monday we get together and we go over NCLEX content. We do Monday motivation. Our entire goal is for this week, you to get started off on the best foot possible. And at the end of it, get your nursing license, because that's what this is all about. We are not doing this for anything. We are doing this for your nursing license. And so we have med-surg review via NCLEX questions, right? And we are be going over that content, sponsored by the NCLEX virtual trainer. Come on in, nurses across the nation, as well as my international nurses. I am super excited for the international nurses and ReMar family because we have so many great things coming up for you guys. It's going to be so good. Here is our first NCLEX question. Without further delay, let's do it. Question number 1. A nurse has just received report on 4 clients. Who should the nurse see first? Is it number 1, a client with a diagnosis of head trauma who does not remember his name? 2, a client with a diagnosis of acute traumatic brain injury who has a blood pressure of 87/57. 3, a client diagnosed with acute renal failure with a serum ammonia level of 15. Or 4, a client with viral meningitis and signs of meningeal inflammation. Come on in, it's time to win. Get your studying brains out. We are talking about prioritization. Who should the nurse see first? And here are the choices again. You have a client with diagnosed head trauma. They do not remember their name. 2, client with an acute traumatic brain injury who has a blood pressure of 87/57. All right. 3, client diagnosed with acute renal failure. That ammonia level is 15. And or the client with viral meningitis and signs of meningeal inflammation. All right. I see you. Jamaica shout out in the house. Woo, can't wait to get back to Jamaica. All my international nurses, come on in. All right. The correct answer, you may know it. You may be surprised by it. However, a lot of people are on point here. The correct answer is absolutely number 2. That blood pressure is too low. Yes. So remember, hypotension is going to cause even further issues to the client who has a traumatic brain injury. You got hypotension, and hypoxia are the greatest threats to a functional brain, particularly if you already have a brain injury. So you got to catch that and correct it as soon as possible. Did you get it right? Did you get that one right? That was tricky because the patients were all over the place and you got numbers thrown at you. But remember, we are thinking, if I don't come to which patient are they going to be the most affected? And so that's prioritization for you. All right. Now let's go back to, let's do the next question here. Okay, question number 2. Thank you guys. Question number 2 is this. A nurse is caring for a surgical client with newly placed chest tube. All right. A nurse is caring for the surgical client with newly placed chest tube. The nurse discovers that a chest tube has become disconnected from the main connection site, okay, and closed drainage unit. Which action should be taken by the nurse? All right. So what are we going to be doing? The immediate action here is it number one, cover the insertion site with a sterile petroleum gauze pad. 2, clamp the chest tube nearest to the client with a soft tip hemostat. 3, reconnect the drainage tube to the chest tube. Or 4, immerse the distal end of the tube in 3 centimeters of sterile water. All right. And this is one of those questions that, sure enough, is emergency protocol. And absolutely, just do you know the basics of med surg when it comes to chest compromise and closed drainage systems. Got to know it. Got to know it. All right. And if you have the virtual trainer workbook, you guys know we definitely go over chest tubes and chest tube protocol. It's very important for you to know. So get out this book. And if you don't get this one right, make a note. Okay. So the correct answer is going to be number 4. Number 4. All right. This client needs to have their distal end of that tube down in sterile water. So the nurse management of a disconnected tube from the main connection site of a closed drainage system is to place that tube ending in a sterile bottle of water. Okay. The nurse should not clamp the chest tube at this time due to a risk of a pneumothorax. Also, it's the chest tube that's faulty, and so the nurse should not try to reconnect it. If the chest tube is still in place, the nurse should not cover it with an occlusive dressing. A lot of people pick number 1, cover it with an occlusive dressing, but you don't want to do that if you still have, right? If you still have the closed drainage system in place. Okay. So if you still have that, then that is going to be your best course is going to be removing the tubing and putting it into sterile water. So yeah, you do gotta read it, and you gotta kind of make sure you understand what you're being asked. That's so difficult, right? Okay, let's do another question. I'll give you guys another opportunity. Let's check this one out here. Great. We're going to go to peds. A nurse is preparing to take a 6-year-old's pulse for the first time. The client has developed pneumonia and his temperature is 38.7. Okay. Which action is most appropriate? All right. Which action is most appropriate? Is it number 1, asking the parents to do the pulse check? 2, telling the child that the procedure does not hurt? 3, showing a picture of a cartoon getting their pulse checked? Or 4, explaining that the blood pressure checks the heart pump? Okay, all right. Come on in, share this video, right? Share this video and let's get more ReMar nurses on board. A lot of people should be here, but they're not here studying. And we want to make sure that they do understand this is the way to being confident, practicing, right? For your big day, And I'm so glad a lot of you got this one right. The correct answer indeed is, I think everybody got it right. You guys are all on one page. It is number 3. It is number 3. And if you know Piaget's theory of cognitive development, well, this is it. All right. So the stage begins around age 2 and lasts until approximately age 7. And so during this stage, the child cannot use logic. We're talking about a 6-year-old. They can't use logic or, combine separate thoughts. If you do this, then this will happen. They don't do that. So the nurse should not try to explain complex medical equipment or suggest concepts that might frighten the child, such as pain, right? So in general, try not to even use pain to a little kid. Don't even bring it up, right? The best approach to facilitate a 6-year-old's understanding is to show a cartoon, movie, or allow the child to pretend to do the procedure. All right. Are we all cool with that? No questions about that, right? We all understand that. Let's go for the next question. And this question, I'm really interested to see the answers on this question. We're going to keep it in peds, but as I was writing it, I just wanted to know how would the nurses critically think this one through. So here's the next question. It says this. All right. A nurse is educating new parents on safety prevention. Which activity is the most dangerous to a 10-month-old client? Is it number 1, taking a bath? Number 2, eating popcorn? 3, playing in a playpen alone? Or 4, sleeping in a car seat? Oh my goodness, I can't wait to see I cannot wait to see what you guys say about this one. What do you think it is? All right, we're talking about 10-month-old. We are talking about practice analysis, what the research shows about 10-month-olds. So we're talking about, I want you guys, not what you think. I want you guys to think about what the research shows. Okay. All right. Share this video. Yes. All right. So educating new parents on safety prevention. Educating new parents on safety prevention. All right. Educating new parents on safety prevention. All right. Is there anybody else that wants to pick a different answer? I don't usually do this. All right. Is there anybody else that wants to pick a different answer? Most of y'all are picking 2. Most of y'all are picking 2. Is there anybody else that want to be different, want to pick a different answer? All right. I'm waiting. I'm just waiting. All right. The correct answer, guys. The correct answer is going to be number 1. Drowning is the second leading cause of death in children after motor vehicle accidents. Parents need to be educated on water safety tips in infants, including never leaving children alone in the bathtub. All right. And having less than 2 inches of water in the bathtub. You guys know this. You knew this. You knew water safety and drowning is one of the biggest things that new parents are educated on. Remember, the NCLEX is based off of what? It is based off of research. It is based off of our practice analysis. It is based off of what the numbers show. So not a lot of parents are going to be feeding a 10-month-old popcorn, right? Not a lot of parents are going to be feeding a 10-month-old popcorn. However, how often do you bathe your baby? How often do you bathe your baby? You're bathing them daily, right? You're supposed to be bathing them daily. After the first week, you wash them down in the beginning, but then you put them in water, right? And so at 10 months old, babies are usually sitting up, right? They're usually maybe trying to crawl. They're very mobile. So it is super common for a mom or dad to put their baby in the water and, oh, I forgot the special soap, or, oh, I forgot to get a towel, or their washcloth is in the dryer. And so instead of taking the baby out, they leave the baby in the water, run and go and get whatever they forgot. It's common. You're a new parent, right? And so that baby is at risk for what? For drowning. All right. So taking a bath is going to be, right? Is going to be the most important thing, the most dangerous for that baby. All right. Yes. Every day you bathe them. Every day you bathe them. Okay. So we are studying content. This is the NCLEX virtual trainer. You guys know this is where I keep all of my lecture information, my practice exams, my homework. If you still don't have your NCLEX VT, check it out. It's super easy to get. ReMarNurse.com. I cannot tell you guys how much I appreciate the testimonials. Shout out to Nurse Madison, who said, she sent me a testimonial video and basically said, you are in the right place. So studying this helped her. She was a repeat test taker. And I appreciate all the testimonial videos that we get to come in. Your ReMar Nurse shirts will be coming in soon. But as graduation season approaches, guys, if you have not committed to an NCLEX review, even if your school told you to do one, I'm telling you, get the NCLEX virtual trainer. It will make everything else make so much more sense to you. So much more sense. So our NCLEX motivation is empty your hands. I want you to stick around for this motivation. All right. NCLEX motivation is empty your hands. What does that mean? I hope some of you guys are thinking about what it means right now. Also, while you're thinking about it, let me introduce the NCLEX Anxiety Workshop. Day 2 is available on YouTube. Also, you could probably see it on Facebook too. But that test anxiety workshop was so much fun. It was super phenomenal. I hated that it had to end. And so I'm trying to do one of the activities we did in today's Monday motivation. But oh my goodness, what an amazing time. If you have not seen the test anxiety workshop and you know you struggle with test anxiety, go back, watch that video. All right, watch that video. Okay. So empty your hands. This is a very simple thought. If your hands are full of things from the past, you cannot grab hold to your future. Oh my goodness. Things of the past, you guys, letting them get in the way. And you see, I put that garbage can there because some of the things we carry from the past, we need to let go. It's trash. It's not going to help you. The excuses are not going to be fruitful to you. So let this stuff go. Let this stuff go. A lot of people say this, I got no money. Okay. I got too many kids. I got a low paying job and studying is difficult. So if somebody, or even if you had one of these excuses, what could you say to yourself, right? Because having no money, that's something of your past. All right. If you're moving towards your future, what can you say to somebody that says, I got no money, right? I want you guys to do this. We did this during the NCLEX anxiety workshop, and we just turned the negative statements. We turned them into something with a positive ending. So tell me, I want to read the comments. I want to see what you guys are saying about this. If somebody says, somebody that wanted to pass NCLEX, you know, they needed some motivation. They said, I don't have no money. I don't have no money. What should I do? I don't have no money, but what? I don't have no money, but all my needs are met. Is that anybody in here today? I ain't got no money, but all my needs are met. This is the way you have to look at it this week, all right? Because chances are you might not have any money, but if you're watching this via internet, you got access to internet. You might got access to cable, probably do. You got a cell phone, you got a laptop. All of your needs are met. You probably got too many clothes, right? Some of us, you know you're rich when you got clothes for every season. So that means when it gets springtime, you pull out the spring wardrobe. And then when summer comes, you pull out your summer clothes. And then when fall comes, you got fall boots. And you just got so much stuff. All of your needs are met. And so you don't have to live in lack and you don't have to claim lack, right? All right. And so I want you to think about this. All right. What about this? I got too many kids. Is this somebody's testimonial where it's like, yes, so many kids, my kids, and you guys know I'm right there with you. I have 3 kids. So I am busy. I don't have time. I don't have, barely time for myself. But every Monday, guess who I'm with? I'm with you, right? And so you can have a lot of kids, but let the kids be your what? Your motivation. How many people think they got too many kids? You just got too many. You should have stopped at 1. Should have stopped at 4. Should have stopped at 7. Shout out to all the moms with 7 and 8 kids, because y'all are my heroes. So instead of saying I got too many kids, I got too many kids depending on me, and I will not fail. And I will not fail. All right. And so that is an amazing, amazing testimonial to have. I like that. Some people are like, I don't have my kids yet, but listen, listen, when they do come, understand you will not be able to fail. All right. What about this one? I got a low paying job. I have a low paying job. Yes, listen, before I was a nurse, I remember those days. I remember those days where the job just was not paying the way I needed to pay. And that was one of my motivations to get my nursing license. I was just tired of looking at that paycheck and thinking of all the time I traded for this little bit amount of money. I'm working every day, 8 hours a day. I mean, I was a cashier. I was working in the hospital. I mean, I just was giving up so much of my time, and the trade-off, it just wasn't there. I was making like, I don't even know, $8.20 an hour, maybe not even that. I don't even know. It was minimum wage. I was years and years ago. My goodness. I just wanted it to be over. So I got a low paying job, but after I passed NCLEX, hey, some of you guys, after you pass NCLEX, I see the houses. Y'all send me pictures of the houses, and you send me pictures of your cars and all the things that you have, and happy kids. We talk about the kids. I got a testimonial from one of the ReMar nurses, and she was able to take her kids to Disney World, which you guys know, I didn't go to Disney World when I was a young girl. I had a single mom. Disney World was just not in the possibility, right? But after our ReMar nurse became a nurse, she was able to take her kids to Disney World, which is no inexpensive thing. It takes some money to go there. And so after you get the job of your dreams, you are able to provide for your family in a new way. You are able to provide for yourself in a new way. Pay off that debt, or, get a loan for a bigger house or a better car, whatever. It's yours. You just have to stay committed to this process. And when you get to the other side, oh, I'm telling you, it's so much sweeter. It's so much sweeter. Hey, and this one. Studying is difficult. Studying is difficult. So a lot of people it's the truth. Studying is tough. It takes a lot out of you. It's boring sometimes. You got to show up when you don't feel like it, right? It takes difficult discipline. You got to do it over and over and over again, right? Who doesn't like to study? Ugh, my goodness. But what about this? Let's empty our hands of that thought and think studying is difficult, but I'm in my right mind. I can take on this information, right? It's not too difficult. And here's my thing. If somebody else has already done it, I know that I can do it. If somebody else has already passed the test, I don't care who that person was. I'm able to pass that same test. I am no less than anybody else, right? And so I have my right mind. You have your right mind. You can look out on a situation and look and say what's good and what's bad about it, right? And so I know you guys are thinking, I see some people posting what they get paid right now, and I know that's not enough for all that you bring to the table. I know that what you bring to that job is so much more than that $8, that $10 an hour. $10 an hour is not going to cut it for what you want to do. I know y'all. Y'all like to have the best stuff. When I see how you guys dress, I see the places that you live in. You want to have the best, and you deserve it. Your children deserve it. Your family, your mothers deserve it. Your parents. A lot of my ReMar nurses want to take care of their parents. They're working to provide for their parents. And so I see you guys' heart, and I'm telling you, your dreams are on hold until you get this nursing license. All right. Because making $10 an hour is not going to cut it for the lifestyle y'all want to live. It's just not. All right. And so you need to level up. All right. Invest. A lot of people don't know this word. Invest in yourself. Right. And so if you invest in yourself, then you can invest in other people. It's easy. Then you can invest in other things. You guys, I could go on and on and on about all of the things that I see you guys doing, even greater than me. Y'all come on here and y'all watch me. But honestly, I'm expecting even greater than you. I mean, than what I'm doing in you. So it's just a process. Everybody starts where you are. Everybody takes it one day at a time. It doesn't matter how you get there, but you got to get there. You got to get there. All right. And so I love this one. Studying is difficult, but I am in my right mind. I am in my right mind. So Edwin says travel nurses are getting $85 to $127 an hour. Oh yeah, sure enough. Sure enough. Even more than that, I got a job. You guys know I did travel nursing years and years ago. And I still get these updates from people that want me to work. And it's literally like, hey, come make 8,000 this week in the ICU. Sometimes I keep them. Sometimes I'll post them. But all the time. So $85, $95 an hour, plus sign-on bonuses. When I was a travel nurse, you get, what was I getting? I think I was getting $70 an hour, but also I got a car while I was there. My housing was paid for. I got a stipend for $125 a day for meals. And I wasn't eating $125 a day worth of food. And so that was just money that I was just saving. Plus I was getting the paycheck every two weeks, and I had nothing to buy. I literally had nothing to buy. I was wearing the uniform, same clothes every day. And so that's what I'm saying, you guys. The money is out here. People are worried, oh, there's not enough money. Oh, I gotta wait for the government to send me my check. What? You don't, especially if you are educated to be a nurse. You are your own stimulus check. We've been saying that, and we really mean it. You guys have no idea. There is not a lack of money. There's not a lack of money. There's a lack of nurses. There's a lack of nurses. And so you have to tap into what you are needed to do, right? And then everything else comes after that. So get in the books, get on the grind. Thank you guys for making quick facts for NCLEX 5-star rating on Amazon. That's pretty hard to do, right? And so I am just so excited for all of you who are passing NCLEX. Send me your videos, especially if you're using the virtual trainer. If you don't have the virtual trainer, 99.2% pass rate for the NCLEX VT. If you are a new subscriber and you want to get the VT, this is the coupon code. When you visit ReMar Nurse, put in this coupon code. It is no stress. It's no stress. So head over to remarnurse.com, put in the coupon code, no stress. All right. No stress. And that is going to give you the ability to take a discount for that VT. I had such a great time with you guys today. It was like a power session. Usually when I come on here, it's like boom, boom, boom. But today we really got motivated on the excuses, letting go of the past so we can grab hold to our future, because it's right there. It is right there. And if nobody told you today, let me tell you this one. You can, you will, and you must pass NCLEX. Have a great day, everybody. Thank you for studying with me. You mean the world to me. Shout out again to all the ReMar nurses who are passing NCLEX. Come back and encourage us, motivate us. Don't forget about us. You have a responsibility to this family. Once you get your nursing license, you got to give back. You got to give back, because that's what we're all about, right? All right, guys. See you later. Bye-bye.